In the United States, medications that can be purchased without a doctor's prescription are called over-the-counter medications, or OTCs. There are many different over-the-counter medications that can be used to help alleviate pain. Some of these medications may have an impact on different parts of the reproduction process, such as ovulation. Are there over-the-counter medications you should therefore avoid? Which ones? Can you use these medications with fertility treatments? I am fertility expert Dr. Morris M.D. On this channel, I take complicated medical concepts and put them into easily understandable action items that you can use to improve your odds for becoming pregnant and delivering a healthy baby. Stay tuned. There are two main categories of over-the-counter pain relievers: acetaminophen, which is the medication in drugs like Tylenol, and non-steroidal anti-inflammatory drugs, or NSAIDs. Common examples of NSAIDs are ibuprofen, which is in Advil and Motrin, and naproxen, which is found in Aleve and Anaprox. There are many other types of NSAIDs. The way that these medications work is important. NSAIDs are potent blockers of an enzyme called cyclooxygenase, or COX. Blocking COX lowers the levels of a group of chemicals in our bodies known as prostaglandins. Prostaglandins are responsible for pain, fever, and inflammation. Prostaglandins are not all bad, though. Some prostaglandins have important functions in reproduction. For example, two different prostaglandins are involved in the process of ovulation. They assist with maturation of the follicle, rupture of the follicle, which releases the egg, and formation of the corpus luteum, which produces progesterone after ovulation. The use of NSAIDs can delay or even prevent ovulation. Prostaglandins are also involved in implantation. When an embryo gets close to the uterine lining, it sends signals which can cause changes in the uterine lining which allow implantation to occur. One of those changes is an increase in prostaglandin levels. Several years ago, an internet survey of women attempting pregnancy found that the use of naproxen lowered the chance for pregnancy. Acetaminophen did not, and ibuprofen did not. Nevertheless, at my infertility treatment center, we recommend that women avoid taking all types of NSAIDs at any time except around the time of menstruation. During fertility treatments, however, there are times when we would like to delay or prevent ovulation. During IVF, for example, we want eggs to mature in the follicles in the ovary, but we don't want the eggs to be ovulated before we've had a chance to extract them. IVF centers will commonly use medications like Lupron, ganirelix, or Cetrotide to prevent ovulation. But could we use NSAIDs instead? Maybe. Some studies have used NSAIDs successfully in IVF cycles. This may have the most benefit in natural IVF cycles in which the use of medications like Lupron, ganirelix, or Cetrotide can't be used. Our Infertility TV bottom line is this: if you are trying to conceive, avoid the use of NSAIDs except during your period, unless your fertility doctor specifically recommends it as a means to help with the process. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.